Article of this week titled Immediate Pre-Endodontic Dentin Sealing Improves Resin Dentin Bone Strength. It's an in vitro study done by Brazilian group and published in Journal of Aesthetic and Restorative Dentistry recently in 2025. Dentin hybridization has been suggested to be performed before exposure to saliva, blood, impression material, and temporary cement in indirect restoration since the 1990s, a technique known as resin coating, dual bonding, or immediate dentin sealing. The application of immediate dental sealing technique has been suggested before root canal therapy, a technique named pre-endodontic treatment restoration, donut technique, immediate endodontic access cavity sealing, or immediate pre-endodontic dentin sealing. This study evaluates the influence of chemicals used during root canal therapy on the resin dentin microtensile bond strength and the protective effect of immediate pre-endodontic dentin sealing. They have 20 recently extracted and caries-free third molars were collected from patients between 18 and 35 years of age. Teeth were mounted on acrylic plates and were divided into 4 groups using a randomization software to reach 5 teeth per group. In the IPDS group, the specimens were submitted to dentin hybridization before the exposure to endodontic chemical substance. In the LDH group, dentin hybridization occurred after simulating the endodontic treatment at the time of final restoration. In the BLDH group, the dentin hybridization occurred after simulating the endodontic treatment and after the repreparation of the dentin with a diamond-coated ultrasonic tip. The dentin hybridization was performed with a 2-step self-etch adhesive system, and a 0.5 mm thick flowable resin composite layer was applied for the hybrid layer protection. Simulation of endodontic chemicals exposure was by submerging in 5 ml of 2.5 sodium hypochlorite 5 times for 1 minute each, and submerging in 2 ml of 17% EDTA for 3 minutes, and final submerging in 2 ml of 2.5 sodium hypochlorite for 1 minute, and drying with absorbent paper, application of AH sealer, and waiting for setting for 10 minutes, and cleaning of excess with 95% alcohol for 5 seconds with a sterile coating swab. After that, direct composite restoration was done. After 24 hours of immersion in distilled water, a precision cutting machine was used to obtain 1 mm thick beams, and using instrument machine, the forces at fracture were recorded in newtons. The failure mode of each beam was determined under a stereoscopic microscope and classified as an adhesive failure or cohesive failure. The adhesive failure if the fracture was between the adhesive layer and dentin, or if the fracture occurred between the resin flowable resin coating and restoration, and the cohesive failure if the fracture occurred exclusively within the resin or composite or the dentin. For the result, the highest bone strength values were found in the control pre-endodentin seal and dentin seal after ultrasonic preparation groups, without statistically significant differences among them. The lowest value was found in the late dentin sealing group, statistically different from the other 3 groups. This box block showed that when dentin hybridization occurs before exposure to the endodontic chemical substances involved in endodontic treatment, there was an increase in bone strength of 238%. Similarly, there is a 252% increase if the dentin is re-prepared after endodontic treatment and then hybridized. And this table shows the failure mode of distribution, and overall the fracture pattern results were mostly restricted to the hybrid layer. They also did the SAM for some of the samples, and the AMB shows dentin sealing group after ultrasonic preparation. It shows intact and interrupted interface. As for picture C and D show late dentin sealing group with interrupted interface and failed dentin hybridization due to contamination by endodontic chemicals. In conclusion, the early dentin hybridization before endodontic treatment positively influences the microtensile bond strength to dentin. It does not only improve dentin bone strength but also allows preservation of healthy tooth structure as well as reinforcement of weakened cusp and improvement of isolation if combined with deep margin elevation when necessary.